2 weeks ago, I took my son to a specialist in Trinidad. You know, we got there at about 8:30 in the morning. I left at 12:30 p.m. after spending $500 to see the specialist. I carried every newspaper. I read all 3 newspapers during that period. A little later, we understand that the people at the accident and emergency at the Scarborough Hospital has gotten the figure down, hovering somewhere around 3 hours, 52 minutes. Not bad at all. Please allow me then the opportunity to highlight some of our major initiatives delivered to date. The acquisition of 4 ambulances. This has meant improved reliability and expansion of the emergency medical services on the island. The unit now responds to 300 cases per month, Mr. Fredericks. The appointment of the Chief Executive Officer has proved timely and strategic to ensure a successfully rollout of the TRH's transformation process and institutional development. In fact, if there was a race for the CEO's position, our CEO, Mr. George Bell, will not be the unsuitable one. And incidentally, he doesn't need a mentor. Recent renovations at the Accident and Emergency Department has provided a comfortable and more organized waiting and triage area for clients. The establishment of the oncology unit makes it the only unit of its kind in Tobago. The mobile cancer screening unit is now a fixture in the communities, providing services for women in convenient locations. 1,117 women of all ages have accessed screening services during the period 2009 to 2010. The installation of the state-of-the-art high-capacity incinerator at the Scarborough Regional Hospital means a more efficient and environment-friendly medical waste disposal system. Paul, all right? Noteworthy among the board's successes, the planning and rollout of refurbishment works for the new laundry. Paul oversighting that one also. Construction is in strain, and the laundry is expected to be fully operationalized by the last quarter of 2011, just in time, prior, that is, to the opening of the Scarborough General Hospital. A patient-focused emergency airlift services policy and operations system to manage critical patients who must be airlifted to Trinidad has now been developed. This new policy takes into account the particular needs of the patients and their families and accompanying caregivers whilst in Trinidad. Efforts are rapidly progressing in the establishment of a 2-bed coronary care unit at the Scarborough Regional Hospital with the support of the Johns Hopkins University. Now, this unit will expand the clinical program at the hospital by offering healthcare services presently only available in Trinidad. Members of the nursing staff are being trained in this special area as we speak. Now, the post-VSEP Food Services Department is now a well-structured department with adequate, dedicated, and committed staff. Historical problems of, I'm allowed to say, indiscipline only, and poor communication among staff have been reduced. Today, this department is one of the services that has visibly improved as a result of the elimination of the dual-track reporting system. In the immediate future, the necessary accreditation that will sanction the quality of the medical laboratory day-to-day operations, its accuracy in the performance of proficiency testing and reporting, the competence of its highly qualified staff, and its on-site laboratory facilities will be in place. Upgrading the hard infrastructure, ladies and gentlemen, of technology and bricks and mortar is important in healthcare delivery and increasing access to service. The opening of services at this wonderful facility, Scarborough Health Center, the establishment of the outreach clinic in Patientsill, and the installation of the walk-in services in its newly facility at the Roxborough Health Center are important deliverables that were realized. In the near future, the Charlottesville Health Center, as alluded to earlier by the CEO, will also be commissioned, and the Golden Lane community will have outreach health services. The Golden Lane community will have outreach health services at their convenience. Now, we are extremely proud of the efforts of the TRHA, which culminated in the development and implementation of 5 major policies and procedure manuals that serve to govern and direct our human resource practices in the organization as an integral part of our institutional strengthening initiatives. Very important that we develop the right chassis to execute these deliverables. And that effort was intended to do just that. Increasing efforts to correct the gap in staffing is also very important. The TRHA is at a significant point of the journey towards achieving its vision of patient-centric healthcare. Bolstered by a solid foundation for transformation, the healthcare landscape in Tobago is steadily changing, enhancing, and improving. And the board is pleased to have been instrumental in guiding these positive developments. Before I close, I would like to say it has been a great honor to serve with my colleagues on the board of directors. I would also like to salute the staff of the TRHA, the Scarborough Regional Hospital, and the health centers for their commitment to the greater good. I have seen some talent here that easily matches and often exceeds what it obtains in the private sector. I would like to thank the Tobago House of Assembly for giving the board the opportunity to place a positive mark on healthcare in Tobago. To the clinical and nursing staff who provide service in this new health center, we trust that this environment continues to be pleasing to you and that you remain committed to giving the highest level of care to our patients. Much work remains, of course, but for now our work is done. I thank you for coming on this very special day. And I thank you for giving us an opportunity to serve, one that we will always hold in very high esteem. In closing, then, I would like you to know that the TRHA is up to the challenges, and we are convinced about that. We are convinced that the TRHA is so positioned for these challenges, and we are convinced that it is committed to making positive and constructive contributions towards healthcare in Tobago. We therefore trust that we can count on your support and that all of us can join in designing our collective healthcare future as we pursue the task of continuing to build a service of which we can all be extremely proud.